Well, good day, everyone, and welcome. I'm Pat Milligan, and I have the honor to be the moderator and facilitator for what I know will be quite a dynamic and insightful conversation with a group of women leaders. First and foremost, thank you to the conference. It's the last and final day of the 2020 Women Leaders in Global Health Conference, and you've had major sessions and insights from all around the world. And today, we're trying to make it much more personal for each of you that have joined us today. Our session focuses on the topic of powering and hopefully empowering women at all levels in organizations to build the career and experience they really want to have. And so all of the women that are participating today are doing just that. It's an honor to be with such an amazing group of women leaders. And what's exciting to me is how they're leading their own lives and their own career. They're leading in their organizations. And really importantly, they're making a difference in the sector and the communities in which they work. So with that, and with the optimism that this is a sector that, in my view, holds such great growth potential for women and men at all levels of organizations, I'd love to get started. And so let me introduce our dynamic group today. So Jane Wanyama is the CEO of Aga Khan University Hospital in the beautiful country of Kenya that I've had the honor of spending time in. So Jane, welcome. We have Dr. Saba, who's the Chief Inclusion and Diversity Officer at Medtronic. Again, has been in the healthcare environment, great role at Kaiser. So very, very excited to have Dr. Saba with us. Really admire the tremendous work that Hannan Sulieman has done at UNICEF. And so it'll be such a powerful ability to hear how an NGO, in my view, is setting an incredible pace. And last but certainly not least, someone I've come to admire over a whole career, Rohini Anand, who was the SVP of Corporate Responsibility, Diversity and Inclusion at Sodexo, but now more importantly is taking her insights and learnings and applying them and advising so many great global companies. So welcome to this amazing group. And let me start with Jane. So Jane, good day, and thank you. I thank you for taking all the hard work to make your technology work and being with us today. And you are living the role of a leader and CEO of a hospital in rural Kenya. You are passionate about healthcare delivery and equity, but also when I look at you, you are incredibly passionate about creating an inclusive environment and a diverse workforce. Can you share with us how you actually approach that, given all the pressures in the healthcare sector right now? So look forward to Jane hearing your insights.
Thank you, Pat. Hospitals are generally defined as very complex systems, and given the activities that happen there, together with the interdisciplinary approach to delivery of care that is required in the hospital. But before I get to that, I must say that my background as nursing and life for all nurses makes a difference, because the training that nurses go through enhances their competencies, skills, and capabilities to be able to run hospitals smoothly. And especially in the third world or in the African continent, that is what we do with nurses. Nurses are also made to be able to work with diverse groups of people, both for service delivery and also impacting health outcomes in the community. In Kenya, like you may all know, a girl child has really never been the person to be, has been a lesser person, if I was to put it that way. And additionally to that, traditionally, women have just never been in control of themselves, unfortunately, including up to their health. So as a nurse, I thought that it would make a difference for me to rise to the level of a chief executive officer, where I would be able to bring in my clinical skills, and additional to that, be able to impart on the perception that's there about women and leadership. So this took me to, and in my growing as a nurse, I'm able to see myself understand the importance of being able to include everybody in the process of taking care of patients and running institutions. So this brings me to how I've continued to approach to create an environment of inclusiveness in the hospital. Inclusiveness to me means creating a conducive environment where the team members are encouraged to engage with and contribute in whatever it is that they are doing. Sometimes this has called for seeking for input even from the most timid person, those people that cannot be able to speak. Driven by the Aga Khan Health Services values, I found myself really deep-seated in the role of being fair and quite objective. I believe creating a welcoming culture begins with me, and therefore I must be a role model. I possess a strong sense of personal responsibility for change, devote time, energy, and resources to nurturing an inclusive workforce by investing in people and inspiring others to share their passion and goals. As a CEO, I've found myself being able to exudate what's in people so that they can be able to perform to their best. I have learned to appreciate everyone's voice in my place of work. That includes even the silent ones, that even when people are quiet, they actually are saying something. I've created different avenues for all my staffs to be able to engage with the management and also be able to offer feedback. I seek to understand the staff's concerns, what their needs are, and to be able to deliver clinical quality, patient-centered care as we do, that's our core business. I'm also quite open-minded person and have a passion to learn and a desire to expose any ideas that I find instrumental to help us achieve our goals. On the other hand, I'm also quite curious and always open to listen and engage everyone to help me minimize blind spots and improve decision-making. I engage in a respectful questioning and actively listen to others and synthesize range of ideas. And that goes a long way to make me and make other people feel that they are valued, respected, and well represented. So I am
Jane, so many insights, so many amazing insights, and so many personal insights and professional. So, let's try to capture some of those and talk how you execute as a leader, your passion because of your profession. And that, thank you so much for sharing that holistic perspective. And hopefully we'll have more of it come out during the conversation. So thank you for that very holistic view. But at the same time, you sound so optimistic and you sound very passionate. I wanted to make sure this conversation balances the reality we're all in right now. And Rohini and I had a long conversation the other day about is this or this multiple inflection points we're hitting, the environmental issues, the economic issues, the healthcare crisis. Is this really going to be a force for good? And I thought, Rohini, you had such a good perspective about, a crisis can create real positive change. So I wanted you to share why I heard such optimism, and we'll continue the conversation. But Rohini, can you share your view about why you believe this will allow us to continue the focus on gender equality, and we'll bring everyone into the conversation.
Sure, terrific, Pat, and thank you for facilitating, and it's a pleasure to be with such a terrific panel. It's been a wonderful conference, so thanks for the invitation to the organizers. And I would just say that, I think this is an inflection point. I think this is an inflection point, and there is a sense of urgency. If we don't focus on gender equality, we can lose the gains that we have actually achieved, and it's going to set us back a decade. Let me tell you why. I think there are a couple of things that are going on, Pat. First, I think there's this pandemic, which is the COVID pandemic, and it's a healthcare crisis. The second, I see the economic crisis with the recession and the impact on women. And the third crisis is the social justice crisis and the impact that's having on society, but on women as well. So, we've made gains. And if I can just focus on the US for a second, in the US alone, we've seen increases in our senior level positions that have gone from 23 to 28% for women in 5 years. Slow gains, but there have been gains. And however, with COVID, there's been a dual impact on women. So an impact on healthcare where women are disproportionately impacted, and they're also stepping back and stepping off of their careers. We heard several times that 70% of healthcare workers are women. They're at the front lines. They're more susceptible to COVID. They don't necessarily have healthcare coverage. I was listening in on a session yesterday, and one of the speakers said in Africa, women are not being tested because they have family commitments. So, so I think definitely, clearly there's a disparate impact on women of COVID because of the kinds of jobs they're doing at the front line. So that's a huge issue. The second is this issue of, I think flexibility. Finally, we have flexibility, and I think that's fantastic, and we need to keep it. But we also need to do so with our eyes wide open, because there is this impact, a disparate impact on women, an adverse impact on women. Women have always done a double shift, no matter where they are in the world. And now, there's no childcare. There's no school in many parts of the world. Women are doing 20 hours more work than they've done before, and then men. So you're talking about a half-time job in addition to their regular work, in addition to the housework they were already doing. And they're judged negatively due to family commitments. I mean, how many times have I been on these calls where a man is speaking and a child comes in and everyone says, oh, cute, cute, cute. And a woman is speaking, a woman, executive speaking, and a child comes in, and in people's minds, it's like, oh my gosh, can't she get it together? The interruptions by the family. I mean, that's the unconscious, implicit bias that people have in terms of how women are being judged. So 1 in 3 women are stepping back. And last point, Pat, I know you're going to move on, but women are losing their jobs at a higher rate. They're in frontline jobs, many are low-wage jobs. In the past, when we've had a recession, women's jobs have been relatively stable in those recessions. Now, if we again just look at the US, and this is a global phenomenon, but unemployment rates for women is 16.2%. 16.2%. For men, it's 13.5%. And then it's even higher for marginalized women, for minority women, for women of color, as we call it in the US. So clearly, there is an incredible opportunity. I think we can harness this opportunity, ensure that we have flexibility, but we really are at an inflection point and we have to take this seriously. I think there is a big danger that we'll slip back as women are opting out of the workforce. So we have to keep focused, do whatever we can individually and collectively in our organizations to make sure that we don't lose the momentum that we've gained. And with the social justice movement, I'll talk about that later. But here again, particularly marginalized minority women, no matter where they are in the world, whether it's indigenous populations in Canada and Australia, whether it's the Afro-Brazilian population in Brazil, the Latino, Asian, Latina, Asian, African-American population in the US. I think women are not a collective. So we also have to be mindful of the disparate impact that women are experiencing even within their gender. So let me just stop there and turn it back.
Excellent insights. And we'll come back and talk about how has the social movement actually created the power and energy to take what we've done in gender and apply it more broadly. So think, Rohini, about how you might want to comment on that, because I do think that we took a pause in March or so, and many of us were nervous, but then we had the power of the movement accelerate. And so we'll keep moving through that conversation, but please, let's come back to that. So, and again, if I think about how can all the different sectors learn from each other, participate, I want to turn the conversation to UNICEF because, Hannan, you have been an amazing leader. You've had so many different roles at UNICEF. And I'd love you to talk about how you build the passion for gender equality into your workforce, and how you sustain that passion. Because as an NGO, you're leading, you're doing so much good in the world, but you're doing good in UNICEF. So I really would love you to talk about how you've gotten your workforce, many of whom I know, to be so passionate about gender equality and now more broadly diversity and an inclusive a workforce. So Hannan, love to hear your views.
Thank you so much, Pat, and thank you to the organizers for inviting us. So Pat, I think there's different elements to that. The first part is simply the mission or the mandate of what we do and the programs that we respond to. That in itself is a motivating force. And secondly is our internal workplace policies and so on. So let me just touch on those two briefly. I would say that the way that our programs are designed, where they address really the core issues that affect children, girls, boys, etc., whether it's health, water and sanitation, education, that really beats home to many people because these are the things that many people face themselves in their own lives. So the mandate in itself lends itself naturally to a motivated workforce. And over the years, we've learned sometimes in a hard way where we have not actually taken into account gender equality, gender equity, etc. And we've tried to refine and improve that over the years. And that has brought on board more of our staff and increased the motivation levels. It hasn't been an easy path because it's not easy to tackle the issue of gender in the communities that we work with, but also amongst the donor and the aid community itself. So it's an ongoing path, I would say. So I would say the programmatic areas of work that we do have a lot to do with motivating people. Secondly, in terms of our workforce internally and our internal practices, we, of course, are a multilateral organization. So we have staff in over 120 countries, and we need to be responsive and respectful towards the staff who have to move from country to country and are not in their country of birth or the country where they grew up in. So that in itself lends itself to an organization that has to continuously adapt our policies. We haven't done too well sometimes, but what we've tried over the years is to learn to become more flexible and more responsive and more human-centric, let me say. So what we've done, and we've learned a lot through COVID, for example, as well, is a couple of years ago, we've updated our approach and our policy towards flexible work arrangements. And it was so interesting to see that the biggest uptake was by the female staff. And it has really helped us to increase the motivation levels, productivity levels, and so on. And then COVID hit. So now we're trying to look at how we can actually define our functions based on a work modality that comprises both work and office space. So it's a hybrid model. And we want to move towards that. And we see that as actually a key factor towards retaining our staff, both female and male, but particularly female, because they've been more hard hit. With COVID, they've had numerous responsibilities on childcare, elderly parents' care. They've really felt it much more than our male colleagues.
Absolutely.
And we've seen that through our global staff survey that we just did recently. So we feel that moving towards a hybrid work model will actually make us more gender responsive. So even though we've been certified by EDGE, which is great, and we're very proud of that, we clearly know that there's certain areas we need to work on to do more. And for example, we have focused a lot on making sure that our senior staff, we have gender parity. So we've reached that, but actually the big problem lies in our mid-level staff. We're losing women in the midst of their career. And that's the part that we now need to focus on. And we're hoping that some of our family-friendly policies and a human-centric approach will help us overcome some of those gaps. Let me stop there, Pat, and hand back.
That's amazing. So Hannan, let me just build one quick follow-up, because again, I apologize. I didn't introduce myself, and I didn't think it was, but I've had as a senior executive in human resources, leading regions at Mercer and lots of different places. I became passionate about accountability, right? About holding leaders and cultures accountable. And that's how I became passionate about EDGE. So for our participants, EDGE represents economic dividends for gender equality. And kudos to UNICEF. You are now globally at the MOVE level, but it takes a huge amount of commitment, right? I mean, you can feel good, but you can't take your eye off the ball. And so I'm curious how you've built that sustained commitment, and I'd like to hear your answer to that, because it is a lot of responsibility. Once you go down the path to be transparent and show your data, be accountable, you can't go back, right? I mean, you really can't go back. But how have you gotten the commitment of all leaders at UNICEF to live in that kind of accountable and transparent world?
First of all, Pat, I couldn't agree with you more. You dropped the ball for one day and you're back to where you were. So even in our senior staff recruitment, for example, we had a meeting 2 weeks ago and we're looking at appointments for our senior staff. And if we miss the ball in just one recruitment, our stats go the other way. So we really have to stay on top of it. So I would say that building the sustainability, first of all, comes from our executive director. She's made it very clear that this is an organizational priority, that we have got to meet the gender parity goals. There is no other way. And that has
translated on that leadership from the top, right?
Absolutely.
So really deep leadership from the top.
And that goes all the way down to our country offices. I continue to be amazed by the impact that has on how people behave and what actions they take. Secondly, having the right data to guide us. So we didn't have the data before. Now we're digging into the data, not just by gender, but by age, ethnicity, and so on. And that in itself has given us a lot of indication. So the evidence gets people on board. That's the second. Third is by actually walking the talk. So us leaders in the organization, both women and men, have to walk the talk. We have to demonstrate it in our behaviors, in our recruitment practices, in our interactions with colleagues. Frankly speaking, I think these are the three biggest models. And then the fourth point I would say is how we respect those principles in the programs that we deliver, how we treat communities and how we work with communities. I would say these four are probably the core things that we need to have in place to make sure that this is sustainable, because we can easily fall off the edge certification, and we don't want that. So
no, that's excellent, excellent.
Thank you.
Thank you. All right, so certainly we could spend hours with each of you, and I'm going to try to keep us moving, but I'm excited to shift to Dr. Saba. Sally, you know, you have really been a leader in all things inclusion and diversity. And, you know, in our conversation the other day, you were so passionate about why you have a deep commitment to inclusion, diversity, and now equity. We haven't really talked as much about equity. So very much looking forward to you see this industry through and this sector through different lenses. And I know you have lots of insights to share about why you're optimistic about both the organization you're in and the sector you're in. So Sally, thank you.
Thank you very much, Pat. And I just want to echo everybody else's. It's an honor to be here with this panel, and I appreciate the invitation to be part of this dialogue today. So thank you to you, Pat, and the panel. I'd actually like to pick up from what everybody has just said. You know, inclusion has to be core to who the company really wants to be. So my kind of piece of advice to everybody who's listening is, number one, you want to choose a company that really is purpose-driven, that it has its mission and its values clear. Because when you have that, then the decisions around whether or not to be equitable and inclusive come easier as a sell to your leadership as you engage in this process. And I heard Jane speak very clearly about her own role modeling and how that has to really come from the top. For Medtronic being in this moment in time as a global enterprise, we are very rooted in our mission. And that's one of the reasons that attracted me to Medtronic. One of our 5 tenets is the recognition of the personal value of all employees. So it has been easy to anchor in that mission our pay equity agenda. We are now at 100% pay equity for the United States and at 99% pay equity globally. And we are.
Can we just pause on that? So we have to say kudos, and I know it was a long journey, and certainly your new chief people officer has such a reputation for transparency. So that's the other, so transparency and accountability. So thank you, Sally, for sharing that, because you were not always, you shared it before you were at 99%. So I think that's an amazing learning.
One of the key things that attracted me to Medtronic is also that they do the work without really touting the horn as much as to what they are doing. But the leadership here has been very, very committed, whether the CEO, the CHRO, and now in bringing me through. So inclusion, we're even intentional about its inclusion before diversity, because you can have diversity, but then the environment that people step into is not conducive for enabling the beauty of why you have diversity and the unleashing of the potential of that creative cognitive diversity in thinking to be unleashed when the environment isn't inclusive. I see it kind of like the diversity is the mix, and then inclusion is the environment in which it lives, and then equity is taking it that step further of making sure that there is opportunity parity. integrating your processes and procedures so that they enable that women and all your other constituencies really thrive in that environment through policy, through flexible work hours, through accountability through and through. So to kind of Hannan's points, really it starts from the top. You have to have the CEO commitment. You have to anchor your why in the data. That is very, very key. And I always advise companies, stop making your I&D agenda an HR agenda and make it a core business strategy and deal with it as any other book of business that you have, marketing, sales, whatever. You have goals and you have accountability. And until you do that with your I&D agenda, it swirls. So that's a key driver. I'll turn it back to you, Pat.
So let's come back. I mean, I want to come back because we actually have a question, and think about this. I'm going to ask those of you in leaders in HR to think about this. We have a question about how can HR as a support function, and I don't think they're a support function, so I'll put my bias, better advance gender equality. So Sally and Rohini think, and we'll come back. But I want to go full circle really back to Jane, because, Jane, we were very careful that these words, whether the word of inclusion or diversity or equity, means such different things in different countries and communities around the world. So I wanted, Jane, to have you we've now gone on a good journey, but have you share your perspective on, how does this resonate, when you think about these strategic concepts, right? Building an inclusive workforce, taking advantage of the diversity in the workplace, and now putting responsibility on all of us to do it equitably, right? To not just focus on gender. So I was hoping, Jane, you could comment on, how does this resonate for you as a CEO, but also leading a hospital in rural Kenya, the concepts, how do you interpret the concepts differently? Jane? Do we lose Jane?
Is muted.
No, I'm here.
Okay, hi, Jane. So did you hear my question?
Sorry, what did you say?
So I asked you that the terms, Sally was just talking about her purposeful language, right? So that she really starts with inclusion, looks at diversity, now equity. You talked about that, but I really wanted to make sure that your voice as a CEO and how those concepts, do they resonate, and how do you make that a reality given the multiple roles you play?
Yes, I resonate with what, is it Pat?
Yes.
Yes, I resonate
well,
with
Sally
that.
raised it and I just answered it.
Yes, and I think especially working with the Aga Khan Health Services, what has happened is that we actually have embraced it and then put it as part and parcel of our induction in recruitment of our staffs. We have policies that have made inclusiveness as one of the first priority when it comes to how we engage, how we recruit. We are looking at equal opportunities and are looking at any factors that would go a long way in making sure that nobody feels left out as a member of our staffing. So I resonate with what she says and agree 100%. And I think that has gone a long way. And I'll just give an example that having embraced this in the last few years, we've seen, I work in Aga Khan Hospital, Kisumu, which is the western part of Kenya. For the longest time, it was filled with issues to do with political instabilities and all that. But we've seen that more people are now looking forward to get employed with us. More people are coming forth to come and be involved and engage with the Aga Khan Hospital, Kisumu. So I completely agree with what she's saying. And I think really that's the way to go. Anybody should look out for an institution that actually has put inclusiveness and diversity as part and parcel of their objective.
Excellent, Jane, excellent. So ladies, I'm going to open it up and I'm going to get a little tactical. So there are many participants here today that are building a career in human resources, right? So there are two, so we've got executives that rely on their human resource team to lead change, both clearly Jane and Hannan. but then we've got two exceptional HR leaders. And I, think of Rohini, my life watching you, lead from the front, make human resources a core to the business transformation. You are, you're an organizational transformation person at heart. What, the question really is how can HR really help drive this change? So I'd love to hear, maybe Rohini, you start the conversation, Sally, jump in, but love to hear the views on how can we build a career in HR where you actually can do this really meaningful work. So Rohini, you want to start?
Yeah, I'll start. So I think some of this was actually, I think both Sally and Hannan, referred to it. And I think there are a couple of things here. I would agree with you that HR is not a support function. It's, a business partner and really is there to enable business success, whatever that looks like, whatever the mission of the organization is. So having said that, I think there are four key things that HR can do. One is to really ensure that the gender lens, diversity and inclusion lens, is embedded within all the policies, practices, and systems of HR, the entire ecosystem, both internally and externally. So starting from the talent lifecycle, looking at recruiting, looking at onboarding, development, succession planning, engagement, retention, exit, and really taking that lens to every phase of the talent life cycle, but also beyond that to the community. So it's, an empowered community, a healthy community is a community that we want to hire from because, there's plenty of research out there, McKinsey's research, where they talked about, I think, equal participation by women generating an incremental $12 trillion in GDP. Now, how do you get to that? Yes, in some countries, in some parts of the world, government plays a role, but in many parts of the world, it's the public-private partnership that enables the success and healthy community. So really looking at it more holistically, and I think HR, D&I, and diversity and inclusion doesn't always reside in HR.
Exactly.
In my case, I was reporting to the CEO, so that's one. I would say the second thing is getting really granular. And again, I think Hannan, you mentioned that, really granular about the metrics. Looking at where are the bottlenecks? Where is the sense of urgency? Because it's not just about, metrics, as a, looking at it through just one lens. You really have to parse the data to see where the urgency is, and being transparent with that. And coupled with that is the accountability. I mean, there has to be accountability for this to be successful, whether it's accountability built into your promotion process, as a leader, you have to demonstrate certain competencies in order to be promoted, whether it's built into your performance management process. In Sodexo, where I was, it was actually a bonus that we had, where we had very clearly defined quantitative and qualitative metrics, and, executives and managers were bonused on that. So that's the second. And one more piece I would say is the third piece would be really sort of enabling the organization, both at the grassroots level and throughout the organization. But I think leaders have to lead this. Leaders have to role model and lead the commitment, and it cascades down, but it can't just be leaders. All of you on in this session, it's our responsibility, it's your responsibility to engage the organization as champions, as ambassadors, to bring about that change. And the last thing I'll say is having a compelling reason for the change. There is, Sally, I'm sure will talk about, the fact that for Medtronic, it's part of who they are, their mission in terms of, attending to the patient. Patients are diverse. It's about healthcare disparities. Hannan, you talked about, the mission of the organization, Jane, the hospital, and making sure that all patients get care. So making sure that you build it into the core of the business. And that's why I think HR has to partner with the business to enable the success.
That's great, Rohini. So you, Rohini, said one important thing I want to just see if I get Jane to comment on, and that is holding leaders accountable and managers. So Jane, as you think about this transformation as a CEO, can you just talk a little bit about how you're holding all of your department heads and leaders accountable? Because I do think that, you're setting that tone from the top. So, and then we'll I want to ask Sally a specific question. So James, and then would you mind commenting on that, please?
Thank you. So to hold my leaders accountable, first they must know what I'm holding them accountable for. And for me, it starts off by being very clear and transparent with what is the institution looking at. We have to share the strategic direction of the institution. When we have come up with the strategic direction of the institution, we share the goals and objectives that we have. And after that, then the leaders in the departments at HOD levels then also create their objectives in line with the strategic objectives. Now, it's one thing to do that. The other thing is now how you're going to put in structures to monitor them on an ongoing basis and not only wait until the end of the year to say we didn't make it. So an ongoing interaction and having forums that you can be able to discuss how we are progressing, providing updates is very, very important. I will look at, for example, this year, 2020, we did have objectives for the year, but come March, we had to change everything. That called for us to get down to revise our budget, revise our goals, what can we be able to achieve in this year, and trickle it down to all our staffs and look at what we have to do and what can we hold. And working in a hospital institution, it's actually called for us to re-strategize in coming up with other agendas that we really had not put in place as priority. For example, we had to invest a lot in having to beef up PPEs and having to come up with mechanical ventilation in our private rooms and making sure that our staffs are safe and patients are safe. We had to come up with what we called a COVID business plan and emergency preparedness plan. That called for a complete change of everything. So it is engaging, involving, and monitoring and evaluating and giving feedbacks in whatever forums that are required.
Excellent. So it just is such a dynamic strategy, and yet you're not putting other things on the back burner. You're setting the priorities. So thank you. That's great. So Hannan, I'm going to ask you. We have a question, and then Sally, I'll transition to what we can do in organizations. But Hannan, you commented on how remote working was actually helping you implement your strategy. Can you talk about two things about whether you think this change, this flexibility and what you're doing is going to be a permanent change? And then also how you're helping your managers, advocate for flexibility, because our experience is that it's often the manager that has the challenge. So we've gotten a couple of questions on remote working and flexibility. And I know, Hannan, that's been a focus. So please share your perspective.
Pat, I don't think we're going to go back to how it was before COVID. This idea of a 9 to 5 being in the office is just not going to happen in most of the countries around the world where we work. In some of the humanitarian contexts where we work, staff have had to stay and deliver, but not all of them. So I personally think, and I believe that UNICEF will go towards a stage where it becomes permanent. So we have a model which is a hybrid working model, which includes working from home, working from the office, having surge mechanisms where we can deploy people in, having technical people on retainer type contracts. So the point is to have different work modalities. It's not just about office or home as such. It's broader than that. And that's the direction where we're headed. I think what's important is and in fact, what we've seen, let me backtrack, what we've seen in the last period is that because people, and especially our female staff, have to balance so much when they work from home and there's been no childcare, et cetera, people are more focused on deliverables. And that's exactly where we want to be. In the past, we had a lot of managers who would monitor and assess someone's performance by the number of hours that they're working. What we have seen, even for myself, what I've seen is I want to be quicker. I want to focus on the deliverable. I want to get it done because I have a lot of other things to do as well. So what we need to do is to move our performance management system towards one that measures deliverables rather than the number of papers you write or the number of hours you spend, and we're not there. So we need to work on that. And that, I think, is a key tool for managers to make this work. We've also invested in a lot in terms of well-being sessions for all our staff, including our managers. Management training, we're now looking at how we can have very focused training that's just looking at virtual management of staff. Now, what's also important is to be ready And we're doing this in many countries, but we need to be more strategic about it, is we need to be very clear about those moments when we do physically come together. How do we use those? It's no longer about coming together for a training or a workshop. It's about coming together to build the teams, to have cohesiveness, to be innovative, to be creative, to come up with a new idea. So that's an accompanying tool that we need to keep promoting the idea of working through different modalities. Over to you,
I
Pat.
love
Thank
that.
you.
So that's such a great phrase, the working through different modalities. So thank you. So Sally, so a couple of things. I would love you to talk about what you're experiencing from a remote working and flexibility, and do you specifically see it as an advantage for men and women? And then if Sally, you could, I think we've gotten a lot of questions about, I'm not in a large organization, but I'm passionate about making a change. I know you've got very deep views about how you can start communities and build your version of employee resource groups. So thank you. If you could address both, that would be excellent.
Sure, Pat, thank you. So let's start with the first one. The first one is, has it impacted people differently? Absolutely. Especially women who are in childbearing years or have children that are younger and at home. And there are some really good things that companies can do in order to support women in this type of environment. And it goes back to that word equity. A lot of people confuse the word equity with equality, which means give everybody the same thing, versus equity, which is give people what they need. So we've really put out resources to help with wellness and mindfulness and well-being. We've allowed for more flexible working hours and really honed in on the idea that in an inclusive environment where everybody is allowed to have self-autonomy and create boundaries and really focus on how they can structure their day in order to be productive and still support the business. And we also did a very rigorous exercise. I like how Hannan was saying, focus on the deliverables. We really did a big exercise around prioritizing for now. How do we really take away some of the stuff that we waste time in and really just hone in on the key deliverables that are really necessary to allow for people to work at the time that they can, so more flexibility, and also take out some of the noise and focus on that. And I'd like to pick up on something Rohini said, that it's really important when you look at all these stats that women not back up, and that you be more visible, more vocal, and more unapologetic in your asks for what you need to be successful. And I think that continues to drive the agenda. And it kind of leads me into the second question that you had, Pat, which is, something that's very common here in the United States and in many global companies is employee resource groups. Employee resource groups, if you're in a very small company, you can still start it. In my prior company, Kaiser Permanente, our largest African descent community or employee resource group started in a woman's kitchen. A leader who wanted to get people together and bring some men allies together, they started at a kitchen table, and it became the largest one. So an employee resource group is really bringing together a group, whether women or other constituencies that you have, who have a common set of needs, and it becomes a way for which, in order for them to organize and to have a voice, because then when they collectively come together and, to Hanan's point, anchor in data as well, and come forward with, here's what we need in order to be successful, then the company can organize around that. And one of the key things around that, like for HR, we've been saying it's a strategic partner, it's not a support. Absolutely agree with that. Even in development programs, there can be differentiated development programs, which is something we have here at Medtronic. We have for women, for African descent, for our Hispanic and Latino network as well. But we have programs that are specific to every community based on the need that they have. So all of these things are things that you build on, but you have to create the way in which employee groups can create community, a sense of community for each other, and have a voice to articulate the need for an organization to know how to support them.
Excellent, excellent. So panelists and ladies, we have 15 minutes left, and so I'm going to ask us to shift to a little bit more personal insight. And I'll start, because one of the questions really is, it's a scary time to advocate for yourself, right? If you're a woman or a man, what can I do as an individual to really continue my advocacy for myself? And I shared in one of our prep calls that I've got a framework that's really worked for me. It's the 3 C's. It's courage, confidence, and conviction. And right now, I believe it's more important than ever, like the courage to really not be afraid to ask for what you want, and really know that if you see an injustice, whether it's pay equity or promotion, you got to be advocating, whether you're a man or a woman, right? The confidence right now, I think it takes a lot of self-confidence to believe that you are really qualified for the role you aspire to be in. You are optimistic about that. And then the conviction to actually make the career you want. So I'm actually going to let it open up and ask each of you, if you think about, you look at the diversity of the participants, they're asking, okay, that's all great, but you're powerful women in leadership roles. What can I do? So please, let's open it up and let people comment. And then I'd like also a comment or two. We have a couple of questions about men, the role of men in this change process. So I'm going to lean back and let you actually have the conversation. So whoever would like to jump in, please.
Pat, if I may come in,
Yes.
I started off as a volunteer, and then, worked my way through up in UNICEF. And what you said resonated very much. I always stuck to the principle of having the courage to speak up. I started off working in my own country in Sudan. And, as UNICEF, we have national and international staff, and I would never let anyone speak down to me as a Sudanese or tell me what my country needs. It's a dialogue. So I was always very insistent to be able to speak my mind, even though sometimes I was scared. Absolutely, of course I am. There's no doubt. I'd be lying if I said I wasn't. And sometimes I would hesitate. But the problem is, if you hesitate once, you will hesitate again. So you have to master up the courage and speak up. And then the first time you do it, you'll see how easy it becomes. It's really important. Secondly, I had 2 things working against me: my gender, my age, my race, all 3, all working against me. But you know what? I would just go into a meeting and I would just speak my mind. They can listen and they cannot listen. It's really up to them. Their loss, frankly. But I actually found that the combination of age and gender was the bigger problem. And so again, you just have to speak up and speak your mind, and you have to persevere. You will be, put back down, and you just have to come back up and say, no one's going to make me quiet, because it's also a learning process for you as an individual. So I really, really believe firmly in what you just said. Commitment and courage is so important, and patience, a lot of patience. And then
perseverance, right?
Absolute perseverance and patience. And one thing I did not do, which I regret, is because I was so busy with work and whatnot, when I saw that other women or even male colleagues were having a difficulty in speaking out or not, I didn't support them enough. And I regret that. And I think we all have to take moments in our day to say, maybe that person needs a little bit of help to speak out. So look out for colleagues who do want to speak out and support them. It takes time, and many of us don't have time, but try to do it, because that also helps. And it recognizes people's achievements, and it recognizes the diversity of the group. I think we're very lucky in UNICEF that we're just very diverse. But the nature of how we're set up. Yeah, and so that in itself is extremely helpful. But be courageous, be committed, and perseverance. Absolutely. Thank you.
Excellent. Thank you.
Great. Can I add to that, Pat?
Of course, please.
So I think both of you said the courage to ask, and I couldn't agree more. I think this, having the courage to raise the issues, draw attention to the issues, have a conversation in a problem-solving kind of way, but do it. Raise your hand. What's the worst people can say is no. That's not the end of the world. The other thing Hannan also said is, in terms of supporting others, and I think this notion of paying it forward, lifting other women up is so important. I mean, you don't have to be at the top of the organization to do that. I think every one of you can do that. And I think speak up when you see injustice done, I think is just so critical. What was it? I think it was Madeleine Albright who said, right? There's a special place in hell for women who help other women, right? So, I mean, I think that's critical. But I would like to answer your second question about male allies and advocates. And I think one of the strategies that all of you in this session can use is to seek out allies and sponsors. And it does so happen that many of people in power are male. Now, I'm not talking about having men validate you, because I think that's not the point. But the point here is to really have allies and sponsors who have the power, who can speak for you and who can guide you, whether it's a male or a female. I think that's absolutely critical. And I think it's in that process, I think what you're doing there is and I think this whole notion of sponsorship is very important to career success, because you can have multiple mentors, and mentors are individuals who speak with you, but sponsors are those that speak about you. So there's a big difference in having a sponsor as someone who's advocating on your behalf. And I think also in that process, you can be teaching your sponsor or your mentor. And I think that's really important, because I think there's a process here where you can be disruptive, but be disruptive in a way that it can be heard. So as a mentee, as someone who's being sponsored, your experiences, when they're shared with the sponsor or mentor, can be disruptive for their worldview. And I'll give you one very, very quick example. When I was at Saba, there was a leader in Europe who was very resistant to the DEI efforts. He got engaged in a cross-company mentoring program where he mentored, a woman from a different company. Now that woman got laid off, and he had a very close mentor-mentee relationship with her. And she shared with him what had led to her termination and how unfair it was and what her experiences had been in her organization. So this man, who had been sitting on the sidelines, even though he was, headed all of Europe, he came to me and he said that I don't want this to happen in my organization to any woman. Okay, this is the first time he actually heard it, but it was her courage to actually share with him what had happened through the mentor relationship, that he became a leader and a strong supporter. So it's mutual. It was mutual, and he said to me, I want every one of my 12 leadership team members to actually become mentors, and each one of them had their own transformation.
So leadership from the top. I apologize. We have 2 minutes left, and they're going to cut us off. But such great insights, Rohini. Leadership from the top. So let me end where we started. So, Jane, I would like you. So, just to we've been trying to really be reflective of these challenges globally. So, Jane, you started with such a passionate view. Did this reinforce your commitment to all things diversity and inclusion? And I just wanted to let everyone say goodbye. So Jane, thank you, and maybe make a final comment quickly, or they're going to cut us off.
Thank you. Yes, this has been quite informative for me. I'm definitely leaving this place. I'm better informed. I would want to just tell the nurses out there, just on the last topic that you've mentioned, that really, when we look for mentorship, we don't have to look at it only within the nursing. We can find mentors out there that can help us be ladders, and that has been my experience. And look out for the opportunities and go to school, expand your knowledge, and you'll get there. Speak out for the nursing.
Fabulous, fabulous. Thank you, Jane. Thanks for all your insights. Hannan?
I will just say thank you. This has been great. It's wonderful to hear the different views. And thank you for including me. And I hope to continue the interaction in some form. Thank you.
That's excellent. Excellent. Sally?
I just want to as well say thank you to everybody. And just a little tip for all the women out there. We didn't start here. We started from the bottom. And yes, here's the 2 key takeaways. It's not a linear path. Take the opportunities that move you around. You don't kind of know where that will take you. Get a mentor, but start with knowing who you are and what you want. Thank you, Pat.
Fabulous, fabulous. And Rohini?
Yes, thank you very much. And, Margaret Mead's quote, never doubt that a small group of citizens, passionate citizens, can change the world. That's the only thing that ever has. So you are the change agents and you can make it happen. Thank you all.
Thank you.
That's great. So look, to summarize, I hope that there were so many great strategies and tactics. I hope the participants today really can take their own insights about what did they learn that can actually help them manage their lives and their work differently. And I think we're all experiencing right now the power of change, right? And I'll just comment that I look at the change that Rohini made in life, and it's a big change. I look at Sally, you going, from an organization you knew well to taking a risk. I decided to go to a startup after 40 years in the corporate world. Hannan, you have really come up through different systems. So Jane, have you? And I think what you see in all of us is change is good, but it's scary. So I don't think right now any of us would say it's easy to navigate change, but the power women have to create the communities and the societies and the organizations they want, I think has never been as strong and is unparalleled. So, on behalf of the conference and the panelists today, thank you so much for joining us, for sharing. And we could go on, and please, the questions we got that we didn't answer, I'll try to get us answers to and give back to the organizers. But on behalf of our panelists and the conference, thank you for joining us today and for all the great questions. And thank you to my colleagues for making this such an enjoyable experience. And it went so fast, as we always know. So thank you so much.
And
have a great rest of day. Thank you.